Hello, here's my introduction. If you think I'm doing a weird tilt with my head to the side, you are right to avoid glare. So in this video, I'm going to cover the anatomy of the vagus nerve. That will probably feel to you a little boring, a little slow. And then I will cover what is PTSD. This may surprise you, or you may already have a really good idea of what PTSD is. And I want you to keep in mind, think big, that people are starting to think of something called CPTSD as having similar characteristics. I think it has not been added to the DSM-5 yet, CPTSD. I do find that many people don't really understand what PTSD is and simply associate it with combat veterans, which, of course, it should be associated with combat veterans, but other folks also have it. Clinicians don't really categorize it as a mental illness because it's more of an impairment of the sympathetic nervous system, and it's more of a case of inflammation. And I think, too, because it has roots in something that happened to you, which other conditions can, but often they're just like biological. And then we'll go over the sweet and juicy research being done at Emory University School of Medicine and Georgia Institute of Technology and a couple other schools, although those are the big players doing most of the work. And this is from a paper about tcVNS to treat PTSD. Don't worry, that term tcVNS will eventually roll off your tongue like butter, if you're paying attention. Just kidding, but tcVNS, there's so many terms in this video. We gotta, have a little fun. So I'm gonna start the video with the anatomy. We'll go through some things, and you will see me at the end to do a fun summary.
Anatomy of the vagus nerve. The vagus nerve is part of the peripheral nervous system where nerves arise from nuclei in the brainstem and travel to the head, thorax, and abdomen. Cranial nerves include oculomotor 2, facial 7, glossopharyngeal 9, and vagus 10. Yeah, that was a mouthful. Vagus nerve is a cranial nerve. Fibers emerge from medulla, pass through the skull, and descend through the neck region into the thorax and abdominal region. The vagus nerve is involved in peristalsis via parasympathetic motor fibers, and the vagus also receives sensory impulses from viscera. The vagus carries motor impulses to the pharynx, or you could say the laryngopharynx. So as you can already say, just the anatomy is a lot to remember. It has a lot of parts. And we have one more part, I think, that is just about function of the vagus nerve coming up. The basic physiological responses to know. 1, the vagus nerve increases peristalsis. That's the muscle movement, smooth muscle movement of the gut and secretions in the GI tract. It relaxes the sphincter muscles. You can guess what that's for. Reduces heart rate. That's what people tend to say when they're talking about rest and digest, and promotes rest and tranquility. The yellow nerve pictured here in the skull and the neck is the vagus nerve, and it is one of the longest nerves in the body. What does the research say? According to an article in the New York Times from last year, June 2022, evidence indicates that stimulating the vagus nerve can help people with epilepsy, diabetes, treatment-resistant depression, and post-traumatic stress disorder, as well as inflammatory autoimmune conditions like Crohn's disease or rheumatoid arthritis. For the sake of this video, we're going to focus on PTSD, and I want you to think of CPTSD, which is not yet in the DSM, as in kind of the same game, the same heart of the matter. And also keep in mind that there's almost always a comorbid condition with something like PTSD, which is why the science is complex. All right. Keep in mind that it's helpful for all medical providers to understand this diagnosis very well. So PTSD is a condition that affects multiple neurobiological symptoms, including inflammation and including increased sympathetic function. According to NAMI, PTSD affects 3.6% of the US adult population, and it affects women more than men. And this part is just really interesting to me, which is we're talking today about transcranial vagus nerve stimulation, and it was first approved actually in 1997 to treat epilepsy, and then it was approved to treat depression in the 2000s, and it was approved to treat migraines in 2017. And there's like a special like pre-approval process happening with Emory University right now, which I'm going to kind of go into.
All right, I'm going to take a moment to briefly talk to you about common symptoms of PTSD, CPTSD, according to this book by Pete Walker. This is a useful book for someone who has been diagnosed with CPTSD. And CPTSD comes from traumatic events that occur over and over, and can be emotional abuse. You don't need the physical abuse to have CPTSD. So here's a list: emotional flashbacks, tyrannical inner and or outer critic, toxic shame, self-abandonment, social anxiety, abject feelings of loneliness and abandonment, fragile self-esteem, attachment disorder, developmental arrest. So that's like when a person, is 40, but they still have behaviors that resemble like a 15-year-old or 20-year-old. Relationship difficulties, radical mood vacillations, pseudocyclothymia, disassociation via distracting activities or mental processes, hair-triggered fight or flight response, oversensitivity to stressful situations, and suicidal ideation. And I think I just wanted to read that because doing this video, I noticed that many people don't know what this is, especially people who don't have it. And the list is intense. I'm pretty sure a person who has CPTSD is not going to have the majority of these. I mean, maybe you have half or a third, but they're like attachment disorder can be pretty serious. Obviously, suicidal ideation is very serious. Relationship difficulties. And I think it's interesting because it hasn't been diagnosed as a mood disorder, so it's always been a little bit harder to treat by clinicians. Like, the research does not show that using SSRIs is as effective with something like PTSD, which is really a disease, and CPTSD, which is really a disease of the sympathetic nervous system. And so it's been hard to treat, and that's why we're talking about this research today in this video. One more thing to recommend: this is an amazing book. It's a memoir about CPTSD, and it's worth reading for clinicians, people who want to be good medical providers, but also people who are kind of looking for insight into their own condition. All right, back to the videos.
Okay, so this is just some hopeful results directly from the study that we're talking about today. So there was this big study done on PTSD at Emory University and Georgia Institute of Technology, and it involved a lot of smart, important scientists, And they came to the conclusion that transcranial vagus nerve stimulation could be effective at reducing interleukin 6, which is a mark of inflammation, and that patients reported fewer and less severe symptoms after this treatment. That is the important part you want to hold on to.
Okay, friends, so here's my summary for you, both for the vagus nerve's anatomy and the clinical outcomes for treating PTSD with transcutaneous vagus nerve stimulation, tcVNS. Sorry for this awkward placement. It's all about the camera and the lighting. Research is relatively new. tcVNS was approved only in 1997, and that was to treat epilepsy. And then research and treatment has expanded since then, and that it has expanded to migraines and I think cluster headaches. And I'm pretty sure it's approved by the FDA to treat depression. The fact that it's being sped up by the FDA is a good sign that it could get covered by Medicaid, the tcVNS. In terms of the science of the vagus nerve is the longest cranial nerve in the body, but the sciatic nerve is the longest nerve in the body, period. Most scientific papers that I looked at investigate tcVNS, but they don't explain why or how stimulating that nerve, in fact, decreases certain proteins like interleukin 6. And it might be that the scientists involved, it's obvious to their brains, or it might just be there's so many details that that one isn't in the study. But it would be interesting to see exactly why. Here's my question. Why, if I have a device here and it's used every day by a certain protocol, would interleukin 6, which increases inflammation, go down? TENS devices, which are devices that use electrostimulation, so they have a very similar modality, have been around for a long time to treat pain. And another just thought I had is, since there are so many different branches just in the neck, I think there are 4 or 5 of the vagus, it would be nice to know when you use this Electrocore device, the one that's being tested is made by Electrocore. It would be nice to know, hey, which nerve is it stimulating the most? Do we know? I mean, you'd have to have a very good understanding of what's deep and superficial here. So those are some of my questions. I'm excited to have found this research and to have shared it with you because it looks pretty promising. And as was listed in the study I just read, a lot of research shows that medication and therapy is not enough for a lot of PTSD patients to get better. And I think anyone who's been on medication knows most medications have side effects. So take with it what you wish. Maybe do a little of your own research, and thank you for letting me share this with you. Bye.
Can't look at you the same way, anticipating heartbreak. And I know, and I know, and I know I'm putting on a brave face to meet you in the same place. And I know, and I know, and I know gotta let my mind find another space, 'cause I heard these scars never go away.